All right. Hi, everybody. Dr. Misty here. Thank you so much for joining me today on Wellness Wednesday. Um, so I wanted to share with you some really great tips on reversing autoimmunity. And before we get started, I just want to kind of introduce what autoimmunity is and what it means to have an autoimmune condition and how do you know you might have it, because this is one of the single biggest issues that I see with people with chronic fatigue, fibromyalgia, issues like that, that is undetected or not diagnosed yet. So um, things that could be an autoimmune condition, things like chronic pain, joint stiffness and swelling, facial rashes or rashes throughout the body, um, consistently getting eczema, abdominal pain, sometimes difficulty breathing, chronic coughs, and then also like just swelling of the extremities. Those are the more common. It's going to depend on what type of autoimmune condition that you have. Okay. So, and the reason I also talk about this is because patients with chronic stress, stress is a big driver of autoimmune presentation. Okay. And so it's important to understand that if you've seen some of my other videos, I've mentioned that some of the root causes of autoimmune disease is a trauma history and developmental trauma. That is one of the diseases that shows up in patients who have had developmental trauma or chronic trauma situations. Also, similarly, is things like depression, anxiety, and then cardiovascular disease. Okay. On here, we're specifically going to talk about autoimmunity and how that presents, and then what we can do about it. Okay. So typically, a patient who is having an autoimmune response, what this is, what this is, what that means is that your body is having what's called an inflammation attack. So you're having like a self attack on your body tissues. Okay. It's driven by your immune system. You have different parts of your immune system. And so something is signaling your body, depending on what type of autoimmune condition that you have, something is signaling your body to say, hey, this is a foreign invading tissue. We need to attack it. And unfortunately, what that does is it starts to destroy and break down your own body tissue. Okay, so if you have a condition, a thyroid autoimmune condition, this is more something like Hashimoto's. Okay, so you might have Hashimoto's, your thyroid numbers, very similarly, like somebody who shows with Hashimoto's thyroiditis, might have okay numbers for a long time. What you might actually see is the TSH going up and up over time. And so, but it's not out of range. But then when you check, because it's not necessarily a thyroid disease, it's an autoimmune attack on the thyroid tissue. Okay. So it takes a little while. That goes undetected a lot. Then if you had something like MS is multiple sclerosis, you're getting an autoimmune attack on your brain. In children, this can be PANS. If you had it on your stomach, it would be celiac. So your abdominal, your intestines, you'll get a trigger response to attack the intestinal tissue. Okay. In rheumatoid arthritis, things like that, where it's more the joints, it's more of an attack on the joints and specific types of destruction. Okay. So in general, depending on where it is, there's all different types and different methods, but what remains the same is the overall theme, which is your body is attacking itself. Okay. So today I wanted to address that's five. Here's six different ways that you guys can help yourselves naturally to help put autoimmune in remission. Now, again, this is informational purposes only. I cannot diagnose you just by symptoms in this video. And this may not work for everybody, and everybody's case is different, but in general, these can be things that are really helpful. Okay. If you guys have any, I'm going to go on Facebook right now. If you guys have any questions, please post them live, and I will try to address them as I go along here. Okay. So, um, so let's talk about one thing that you can do for autoimmunity and things that can help it. So, keeping your immune system healthy otherwise. So, if you have if you are somebody who has a lot of colds, by the way, that's one thing that can actually drive autoimmunity is a lot of infection. So this is particularly true in gut dysbiosis and having a lot of pathogens in our GI tract. So high level of pathogens and not a healthy immune system in general is going to be more detrimental to your immune system, because what's going to happen is your body is in this constant immune stimulation of trying to fight viruses, pathogens, infections, parasites, things like that. So, gut health and cellular health is really important. So, starting with gut health, we really want to make sure that we're having a really healthy gut. Okay, tip number one, really healthy gut, right? 80% of our immune cells reside within our GI tract. Okay. So if we don't have a healthy gut, then we are going to have a depressed immune system because we're not going to have as much ability to fight infection, but also we want to make sure that more good bacteria is within our GI tract, as well as less bad bacteria and not so great things like parasites, yeast, and things like that. So you really want to up your good bacteria in your gut. How do you do that? You can eat things that are natural in good bacteria, fermented foods, things like sauerkraut, things like kombucha, things like yogurt, organic yogurts, things like that have a good high amount of commensal bacteria. Another way that you can do it is kefir. If you're somebody who doesn't do a lot of dairy, which can be inflammatory, doing a good probiotic will be really helpful in this situation too. You got to keep your immunity up so that your body is not overloaded with pathogens that's driving your immune system up. Okay. So, tip number two, um, reducing inflammation. Okay. So, autoimmunity is heavy levels of inflammation in the body. So, if you have an underlying inflammatory problem, so say you are somebody who maybe has a diet high in um, omega 6s, which is things like red meats, potato chips, sugars, things like that, and not enough omega 3s, which are more of wild salmon, walnuts, almonds, green leafy vegetables, avocados, those types of things. Your body may be in more of an acidic state. So you may be way more prone to inflammation. So we got to keep that inflammation level down. Okay. How do we do that? We got to balance our diet a little bit. Okay. Okay. So start adding in things such as what I mentioned, walnuts. Wild salmon is excellent for inflammation and bringing omega 3s into the diet. So help balance that a little more. The other thing is cutting out things just simply, okay? Make a small list, cut out things that are inflammatory, such as sugar. So if any of these are in your diet, try to cut down on them. Sugar, soda, heavy amounts of juice, breads, and then fried foods. Okay, so those are all high fatty, high inflammatory types of foods. If you can bring those down, that's going to help a lot. And you can bring up the healthier foods, get more vegetables in the diet, a little bit more lean meat, particularly on like the fish, turkey, organic side is going to be best for you. Okay. So reducing your body inflammation. Okay. So tip number three, that's really cool with autoimmunity is trying to reduce something called lectin count. Okay. So if any of you are familiar with Dr. Gundry's work, you're going to be right there with me. If you're not, Dr. Gundry is really the specialist in this area. But a lectin is something that essentially attaches to certain parts of the proteins that allows the openings in the junctions between the cells in the GI tract to become kind of loose and open more. So the higher amount of lectin count that you have, the more you have a leaky gut issue. Okay. And so if you watched last week, we talked about leaky gut a little bit and how that can cause problems. If you have a leaky gut issue, this is like an amplifier. This is like pouring gasoline on the autoimmune fire. Okay, if you have a leaky gut issue and you have hyperpermeability, what you're doing is driving your inflammation levels up. It's like turning the volume way up. Okay. So the gut is very paramount in putting autoimmune into remission, at least symptom wise. Okay. So it's important to know that a lot of specific autoimmune diseases, some of them might not be 100% like curable, like you're never going to have it again, but it can be put into a remission state. Okay. So it's important to understand that with these types of lifestyles. So reduce lectin count. What does that mean? How do you do that? So if you are living in an area where things are seasonal and fruits and vegetables are seasonal, you really want to go for fruits and vegetables that are more in season than out of season. So if you're somebody trying to have watermelon in the fall, you're going to see a higher lectin count in those types of foods. The other thing is foods that have nightshade vegetables vegetables that are nightshade vegetables. So things like, eggplant, potato, tomato, things like that can have a higher lectin count. So there's things that you want to try and reduce down into your diet, especially while doing some repair with your gut. Okay. Tip number 4 is actually going to kind of parlay off that. Healing and sealing of the gut can help with the remission. Okay, so things like glutamine supplements, like glutamine and collagen, are really important for the help of the remission and staying in remission, because it's going to help with the healing of the leaky gut. Okay, so what do we have so far? We have lectins, reducing lectins in the diet, reducing inflammation. The first one that I already forgot the first one that I mentioned, I'm sorry. The lectin count and the collagen, and gut health and immunity, excuse me, sorry about that. So improving your immune system and your gut. So this has a lot to do with gut health, okay? The other thing that you want to do is, if you are somebody who has autoimmunity, you want to check for mold and toxins. So this is really big with especially chronic fatigue, but this can also drive your inflammation levels up. Okay, so toxins and mycotoxins. Number 4, we're going to talk about mycotoxins. So what is a mycotoxin? A mycotoxin is a toxin from mold that you can get from breathing in mold. Now, we are getting to a time where we're going to be indoors more. Hopefully you have good ventilation where you're living. You don't have any signs of leaking or musty smells, things like that. Signs of mold exposure and mycotoxins, really big chronic fatigue issues. So a lot of patients that actually have chronic fatigue end up having positive for mold spores as well. But this can really, really increase inflammation and toxicity of your cells. So just breathing in mold, this will also amplify, really kick up anxiety and depression issues. So if you're somebody who's indoors, you don't usually have seasonal depression, maybe you move to a different place and all of a sudden you notice that you're starting getting really tired, you're depressed more, you're anxious, you're starting to be in pain more, it doesn't make sense. You feel like jittery, things like that, and it just kind of was like a sudden onset after you move. That's kind of a key that you might be getting a mold issue. And if you have an autoimmune issue on top of that, that can really really amplify it. So getting rid of mycotoxins, so detoxing, okay, things that will help you do this are glutathione. Okay, so our body's main antioxidant is glutathione. You want to really, if you're doing this and you're actively know that you've been in mold and you have an autoimmune condition, you absolutely need to get that mold treated, and then get yourself on a detoxification protocol. Okay, because what that's going to do is it's going to keep your wheel spinning, where your body is, you're going to be more in a pro-inflammatory state, and it's going to dampen your immunity, which we talked about, right? So the other thing, tip number 5, is going to be filter your water, okay? And watch how much that you drink of or eat of, like things like tuna fish, mercury, and things like that. Some of those toxins, especially mercury, can cross blood-brain barrier and they can create a lot of inflammation, especially in cases of like MS, things like that. You're going to get a lot of more brain inflammation in areas of areas of the brain. So it's really important to understand that what if you can see where I'm going with this is there's so many different pieces, and our whole health in general can have an effect on an autoimmune condition. And number 6, by the way, we're going to talk about is genetics. So turning off the genetic coding. If you are somebody with, say, your parents had autoimmune conditions, this is a key to know. If you have an autoimmune condition, be aware of your family histories. Okay, so knowing, if you know your family history, this may be troublesome in people with, chronic stress type of situations or developmental trauma. Patient may have been in a foster system or not know their parents, things like that, or not know their family history. So that may be challenging. But if you can get genetic testing, something like a 23andMe, as well as you can get genetic epigenetics testing and SNP tests. Why I tell you to do that as a tip is because it will tell you where in your body that you have the most trouble with. So somebody who has an autoimmune issue that has a really bad, like an MTHFR defect, okay, that means you can't methylate as well. You're going to have a lot more problems with detoxification and hormones. So if you are exposed to mold and you have a lot of inflammation in your diet, you're going to have this chronic inflammation issue, right? So understanding your body and removing as much inflammatory triggers, immune system depressants, and toxins are going to be your best friend if you have an autoimmune condition. Okay, there are usually many, so a lot of times, like I talk about, trauma on an emotional level that affects anxiety and depression. There are so many realms and root causes of these illnesses. It's not just the case that if you have an autoimmune condition, oh, your family must have had one. Typically in the medical community, the solution to like an autoimmune condition is usually either steroids or immunosuppressants, so your symptoms goes down. Okay, so what does that do? That makes you a lot more vulnerable. Okay, it'll decrease the inflammation, so your body's not attacking itself, but then you're more vulnerable to infection and you're immunocompromised, right? Definitely not where you want to be right now, especially with the way of the world, and what's going on right now. Um, so that's something to think about if you're going towards medical route, or if you have been towards medical route. Getting testing is key with all this. One thing I do with a lot of my functional medicine patients and health coaching clients is we do a lot of great extensive testing to not only understand if you have an autoimmune condition, but why you have the autoimmune condition. So we're not just looking at what, we're looking at why. Okay, because there can be a lot of these underlying drivers. And what you want to do most often, if we can change some of those things that are driving the autoimmune condition, then we can get to a point to work with a patient, especially on an emotional level. To one of the other things that drives autoimmunity is kind of emotional self-attacks. So if you've had, you've been a patient, or a victim of some sort of an abusive situation, particularly if it was chronic, or even like an emotional abusive situation. Maybe you had an emotional abusive ex-spouse, boyfriend, girlfriend, whatever the case may be. That can really create a lot of issues with self-attacks and like turning on yourself, because you tend to doubt yourself, especially with patients of chronic developmental trauma. It's like you're taught to turn on yourself, because like that's what kids do if they're unsafe. They don't go against the parent, they will turn on themselves, thinking that there's something really wrong with them. So that can translate into this negative self-image, and almost like this thought process of self-attack. So that is a contributor of autoimmune as well. We'll add that one in there as a freebie. So trying to regulate when that's happening, if that's happening, if there's a situation where you're kind of turning on yourself, and doubting yourself, or shaming yourself, or being angry with yourself, things like that. um, those are typically like patterns, learned patterns, and those can actually contribute to kicking up autoimmune as well. So I hope you guys find that helpful. If you do have any questions, I'm going to check them out, and I will try and get to them as quickly as possible. If you need help in this area, I'm happy to help. You can book a virtual consultation with me. I do them right off my website, www.newhorizonchiro.com. If you are out of state, that's no problem. I work with patients all around the country and the world. And mostly if you are in Rhode Island, we can do a little bit more um, with the laws here, but as far as outside of Rhode Island, I can help you as well. So if you have any questions, you can feel free to message me, or you can schedule an appointment online. If you are somebody who feels like they might have autoimmune and they just are stuck and don't know what to do and don't know what's going on with them, and they've tried a bunch of things, like that is my specialty. You're the patient that I tend to work with and help all the time. So, and I've had some great success. There's so many of my patients who have done the work and have, including myself, that have put in their autoimmune in remission. So it's really powerful when you look at the root causes of what's going on, and not just the autoimmune condition, but what's driving the autoimmune condition to keep presenting with all those symptoms. So again, I'm Dr. Misty Kosciuszko. Thanks so much for watching today, and I will see you live next week, next Wednesday. Thanks so much.